Next up, we've got another incredible panel who will be discussing how we can tackle long COVID together. So, without further ado, I'd like to welcome Tim Straughan, Director of NHS at Home, Tejas Suri, Senior Resident at the All India Institute of Medical Sciences, and Maarja Liis Ferry, Scotland Lead for the International Collaborative Grand Rounds. Hey guys, can you hear me back there?
Yep, we can hear you.
Fantastic.
You very much. Can you hear us?
Yes, I can. How are you guys all doing today?
Good. Enjoying the conference?
Perfect. Right, well, without further ado, the stage is all yours.
Perfect. So, thank you very much for joining us today, guys. A little ahead of schedule, which I think is maybe a virtual health careers conference first. One for the history books. So this is the ICGRx afternoon session about tackling long COVID together. And for those of you that don't know, ICGRx stands for International Collaborative Grand Rounds, and we're a non-profit initiative that are passionate about ensuring learning in healthcare remains open access and free to all. So our global team create free open access live events, bringing together healthcare professionals, patients, stakeholders and students to discuss important topics in healthcare and to share best practices to improve health outcomes. So keep an eye out on social media for our next event. You can follow us at ICGRx or see our website icgrx.org. And today we're proud collaborators with Health Careers Live, looking to bring a bit of international perspective and multi-stakeholder perspective to the proceedings today. And now on to the session itself. The pandemic has obviously transformed our way of life and necessitated unprecedented changes in global health systems, unprecedented being the word of the year probably. Vaccine distribution is out the way, and in certain areas case numbers are falling, in other areas they're still rising. But as we move from the acute phases of COVID, there's a new thing on the scene, long COVID. Relatively little is understood about this phenomenon, experienced by quite a high proportion of individuals. And to address this, we need to discuss the impact of long COVID on health and social care systems and how they might prepare to better meet the needs of patients suffering from this condition. But you're not here to hear from me, and our speakers today have experiences ranging from the clinical experience of managing both acute and long COVID to leading home rehabilitation services within the NHS, and they have valuable insights to share from both India and the UK respectively. And I'll let them introduce themselves and a little about their background, and I think we're going to have a really interesting discussion today, and just feel free to put any questions that you have for our speakers in the chat or in the Slido on the right hand side of your screen. So to start off with introductions, Tejas, if you'd like to go first, just introduce yourself.
Okay, hi. So good afternoon to everybody in the UK, and hello to everyone around the world. I'm Tejas Suri. I am a pulmonary critical care specialist who I'm currently working as a senior resident in the Department of Pulmonary Critical Care and Sleep Medicine at All India Institute of Medical Sciences, New Delhi. And I have been working over the last 1 year with COVID, and now also with long COVID or post-COVID patients. And it would be interesting to have the discussion with Dr. Tim and all of you today.
Perfect. Thank you very much. And Tim, if you'd like to go next and introduce yourself and a little about your work.
Yeah, no, thank you, Maarja. So I thought, because it's a careers conference, I would just give you a very quick overview of my career, because I've been working in the NHS for 34 years now, and as the NHS has just turned, it's just had its birthday, its 73rd birthday. I've almost worked for the NHS for half of its life, which is quite incredible. I'm on my 5th, going on 6th career now, so I've had a portfolio career in the NHS. I started life as a clinician, as a dentist. That was my first career. I then went to become a chartered accountant and worked at KPMG. And then my 3rd career was coming back into the NHS and worked my way up the finance director ladder to finance director. And then my 4th career was I became a chief executive. I've had a number of chief executive roles within the NHS, most recently at the Health and Social Care Information Centre, now NHS Digital. Before I joined NHS England, which is where I am now as a director there and working on personalised care. But most recently, Changing again because of COVID, now working on something called NHS at Home, which we're going to talk a little bit more about, which has really been about how we respond to the COVID pandemic. And we've been working particularly around two pathways around COVID oximetry at home. How do we support patients with oximeters to spot early signs of deterioration? And COVID virtual wards, how do we support people at home that have been in hospital or don't need to be in hospital again that could be supported? But very much as we start to restore and come out of COVID, we're now looking at innovative ways of supporting people at home around long COVID and other long-term conditions, which is really exciting. So hopefully we get into that. Thank you.
Brilliant, thank you very much. And an example for our people here today, especially for some who are maybe looking for a career change, that's certainly possible, and you've managed it multiple times. So I think that'll be quite inspirational for some people here today. Excellent. So I'll start with my first question, which is for Tejas, and that is that, here in the UK, we've heard a fair bit about long COVID. It's been in the news quite a lot. There's a few people advocating online for more awareness around the issue. Is there much emphasis on long COVID at the present time in India, or does the primary focus remain on managing patients with acute COVID, as it were?
Can you come again with the question? The question is related to the emphasis on long COVID.
Yes, so is it in India, is there much discussion around long COVID like we have in the UK, or is the focus more on acute COVID at the moment?
So at the moment, the focus is on long COVID because right now we are not in the middle of a wave. Right now in India, the wave has settled. So the main issue right now is the long COVID, because most of our outpatient clinics are dominated by patients who have already suffered from COVID. So as you know, India has gone through 2 waves of COVID, and almost every second person you see in the clinic would have suffered from COVID before. And many of them, because we work primarily in a pulmonary service, so many of our patients come with pulmonary problems which can be traced back to the time they got COVID. So as we know, since COVID is a respiratory infection primarily, so the long COVID symptoms are also predominantly in the respiratory system. But that being said, as we have discovered, COVID can affect any organ of the body, and similarly post-COVID can also affect any organ of the body. And so we have also started a specialized clinic, and this is a trend throughout the country. Throughout the country, different hospitals have started clinics for managing long COVID in a protocolized manner. Yes.
And what kind of activities are these clinics undertaking? What do they do within these clinics when they're meeting these patients with long COVID?
So basically, the first thing is about accessibility. So the patients who are discharged from the hospital, they should have the accessibility to follow up, because many of the patients who are actually hospitalized for COVID continue to have symptoms for months together, as we know now. So they need to have a service where they can come back with their problems, and we are following them up usually within 1 to 3 weeks after discharge. And in this clinic, of course, we have services for clinical evaluation. The doctors are available. We also have psychologists, dietitians, physiotherapists. So that's a multidisciplinary kind of a service. Of course, depending on the resource availability, the different clinics are differently staffed. But some common themes are that we do have chest radiography, and we have common blood laboratory testing, and pulmonary functions. So these are the basic things that are there, and of course ECG, and then we do refer to specialists if we need any additional investigations for these patients. But primarily the accessibility to patients is the most important thing for follow-up care.
Brilliant, and I think it's really interesting you talk about this need for accessibility, and I think that's maybe where Tim can come in a bit. Accessibility of services to patients, and on that note, you said at the moment you're working directing NHS at Home, and that might be a body that some people are unfamiliar with. Certainly, I hadn't heard of it before coming to host this session. So, I wonder if you could explain a little more about the background of NHS at Home and maybe what it does to address accessibility for patients.
Yeah, no, thank you. So NHS at Home was only created about 12 months ago, this time last year, actually, as I say, in response to the pandemic. And it was really about how do we empower patients, citizens, people to take more control. So it's centered around personalised care, but using technology where appropriate. And in this case, using a very simple oximeter, a relatively cheap device. So we purchased a large number of these nationally and made them available to the whole NHS and created a pathway which essentially gave patients a high risk of deterioration. So patients generally over 65 with symptoms or people that are clinically extremely vulnerable, gave them some information about what to do and how to measure their oxygen saturation levels sort of 2 or 3 times a day, and when to call for help. And so if their oxygen levels dropped below 95% usually, we gave them a number or someone to contact. And the idea was that if we got people into hospital earlier, we spotted the signs of silent hypoxia that little bit earlier, we could reduce mortality, a number of people going on to intensive care, and reduce lengths of stay and time in hospital. And it was incredibly effective. I mean, we had a phenomenal response, huge numbers taking it out very quickly. And it really did start to show actually a lot can be done really with just a simple oximeter and a pen and paper and a phone. But we've built on that really and worked with NHS and technology colleagues to actually start to use technology more and more to link up these and do much more remote monitoring. And really now starting to think about many forms of other forms of self-monitoring, which we've been doing for years, but it's taken the pandemic really to accelerate the thinking and the ways of working so that people have been pushed a bit into doing virtual consultations and remote monitoring. Actually, a lot of people have found that it works for them. It's not for everybody, it's not the answer to everything, but there's huge amounts more we could do. So we're now moving out into management of hypertension using blood pressure monitors. So we've got blood pressure at home. We're looking at how we support other long-term conditions. But rehabilitation is a big issue. I mean, we've got huge elective waiting lists. So we're looking at how we can manage people well on waiting lists. But actually, there's a huge number of people, not just with COVID, but with many other conditions that need management. And the people want to be at home generally. And actually, if you can give them the tools and the training and the confidence, knowledge, skills and confidence to do that, actually, we think this is a game changer. So that's the whole emphasis of the program now, really.
Thanks very much. And I guess, as an organisation, probably emphasises that phrase of never waste a good crisis. Obviously COVID has been horrible, but these solutions and approaches have arisen from it. So it's good to hear about positive work that's being done in that space. My next question then is for Tejas, and that would be, you've got experience really working hands-on with long COVID patients. In your experience, what have been some of the ways that it's manifested in terms of its symptoms, and also some of the ways that you've approached it in terms of management of long COVID?
Right. So the symptoms have a wide spectrum in long COVID, and it also depends on what kind of illness you had. So of course, you can have long COVID even if you had a mild illness to begin with. But long COVID is predominantly seen in people who were hospitalized and who had a severe illness. So most commonly, these patients have prolonged fatigue, prolonged dyspnea. It is basically similar to a chronic critical illness or a post-intensive care syndrome, which we used to see earlier as well. So patients are maybe dependent for their activities of daily living, and they may be too fatigued or too dyspneic to carry out their daily activities, and they may develop critical illness weakness because of which they have muscle weakness. And that is the most common thing which we see among patients who were hospitalized, especially in intensive care. But if we go, since only a small proportion of the entire COVID population belongs to the critical care segment, and the majority of people have mild illness. So if we talk about this particular segment, the people who had a milder illness, the common problems include prolonged weakness, again fatigue, and many of them have loss of smell and taste, which may last for several weeks. Those with asthma or airway diseases have prolonged cough. Many people come with palpitations suggestive of myocarditis. And actually there's pretty wide spectrum. We've had patients with pulmonary thromboembolism. So there is a wide spectrum, and we really need to look out for everything. But the main things which we look out for are the cardiorespiratory symptoms as well as the cognition. There is slowing of thinking. There's what has been called as brain fog, and some psychological symptoms in people who are prone to develop anxiety, depression. This is also a time where, because of the lockdowns, you are alone at home. Many people are separated from their families, especially during times of lockdown. So, psychological issues are also important among these people.
Yeah, and it's really good to hear. You've got these multidisciplinary clinics going, and I think that's something that's coming in a little bit in the UK, but we're actually maybe not as caught up with. So it's nice to hear that that's been going on in India. My next question would probably be for both of you, actually, and I'd be interested to hear from both of your perspectives, living in different countries and also as a hospital doctor versus being in a sort of management and home care focused role. So in your opinion, what do you think the unique challenges are that long COVID poses to the health and social care systems in the UK for Tim and India for Tejas? And I'll go to Tim first for his answer.
Yeah, so it's a massive challenge. I think the biggest one probably for me is around the workforce. I mean, we have, I think, 100,000 vacancies when we went into the pandemic. 40,000 nurses vacancies. Huge pressure on our systems anyway, on the workforce. And I think this provides a huge additional workload, I guess, for the NHS, which is why I think we need to be really innovative around how we do that. And I think that's why I think the role of people and patients and data and technology has a massive role to play to think about how we extend the workforce as well. We're creating quite a lot of new roles in primary care in the NHS. Non-clinical roles, but they've got a massive role to play. I think as we upskill them to think about, what has to be done by a clinician, what can be done by a non-clinician, how can we work more in these sort of wider primary care teams to support people, I think is part of the answer, whether that's face-to-face or at home or in, but we are trying to shift more and more work out of hospital. And, I think not just having the right numbers of the workforce in the right place, but having the right skills, the training. I think there's a huge workforce training agenda to teach and to help people upskill and work differently, because this is a whole new way of working, having a very different relationship with people and patients. So I think my big one would be around the workforce, and I think linked to that then is investment and finances. And I think social care is a big topic in the NHS and social care at the moment. So again, how do we get that interface right with social care, because it is around the wider determinants, it is around the interface between health and social care too. So that's a big challenge too.
Thank you very much, and over to you, Tejas, for your opinions on how, to remind you of the question, the unique challenges that long COVID poses to health and social care in India.
So I think the one biggest challenge of long COVID in India is the equitability and access to healthcare throughout the country. As India is a vast country, and there is a lot of heterogeneity in the availability of healthcare in different places in the country, from urban to rural areas. And a large segment of the healthcare in India is delivered through the private sector. So we have coexistence of the governmental and the private setup. And so the biggest challenge here is to provide equitable and ready care, accessible care to all people in rural areas as well as in different parts of the country. So we have good care available in the cities and very good care available at some places. But if we have to really tackle this situation, we have to reach out and make it widely available and train the people who are there in various smaller centers to deliver this care.
Definitely, and thank you for that answer. I'd be curious to know, because we've seen during COVID in the UK, we've seen really rapid introduction of technology to the healthcare space, even for teleconsultations, things like that. Would you say that that's improved this inequality in healthcare access in India, or do you think it's made it worse, this introduction of sort of teleconsultations and things like that?
Actually, teleconsultations have been a lifesaver, I would say. And as Dr. Tim is doing a wonderful job in the UK and delivering this kind of service to at home in an organized manner. In India, as I said, a large segment of the healthcare is handled by the private sector. So the private sector has been very active in providing telehealth services, and also the government setup, like where I work at All India Institute of Medical Sciences, we have also adopted teleconsultations to provide access not just to COVID patients but also to non-COVID patients who are unable to come to us with their problems because of the lockdowns and the COVID restrictions. So, and if we talk specifically about long COVID, again here teleconsultations are very useful because many of these patients may be after COVID, they may have limitations of activities of dyspnea and tiredness, and they may not find it easy to come to the clinic each time. So using teleconsultation, we can provide them early follow-up, and now even tele-rehabilitation is being adopted in many places.
Perfect. That's good to hear, and I'm glad to hear that the telemedicine approach has been useful for you guys. My next question is for Tim, and that is, how is it that the NHS at Home plans to tackle long COVID? Obviously now we're moving into this rehabilitation phase, and do you think technology has a big role to play in that?
So yeah, so the NHS has just set up a long COVID task force, and we're just starting to invest quite a lot of money into that as a service. I think we've put about 50 million into research. I think there's 100 million being allocated for 21-22 plans and how we expand the services. So I think we've already established sort of 89 assessment clinics, and it's a relatively new thing. So we're just working through what that means, what that looks like, how to design that. But we're very much wanting to look at how we support people at home with personalised approaches using technology where appropriate. But we're also very mindful of inequalities, because I think we have to be really careful. We've seen, one of the consequences of COVID and long COVID, I think, is a widening of inequalities, and we've got to make sure that whatever approaches we have, we narrow those inequalities, and we particularly focus on the people that are most vulnerable, most deprived, most at risk, and so that we can close those inequalities. And technology, is right for some people, but as you hinted in your previous question, actually we need to make sure that those that are digitally excluded, or don't have the digital literacy, we don't leave them behind. So we do need to invest particular time and attention into those sectors of the community that really could benefit most. So again, we want to help with that.
Definitely, and I'm glad you're both sort of highlighting inequality as an important thing to address. That's definitely, quite close to my heart in terms of working in healthcare as well. We've got a question from the chat at the moment from Violet, and that is, how do you think we could raise awareness of long COVID with an implication to improve adherence to anti-COVID measures like mask wearing and social distancing? So I guess I'll go to Tejas first. How do you think we could raise awareness of long COVID and the implications of it?
So there has been a lot of talk about vaccination and social distancing, and I think the government as well as healthcare providers have an important responsibility that whenever we interact with as healthcare providers, whenever we interact with our patients on any visit, this is an issue we should raise about COVID vaccination and about the COVID appropriate behaviors such as masking and social distancing. And from the governmental perspective also, the right messaging has to go through to the public. And I think COVID has caused so much of havoc, has wreaked so much of a havoc in India, that right now it is fresh on everyone's minds. And I think there is a lot of stress on this. There is a fear of a third wave also among the people, and the vaccination is being adopted, although it is taking a bit of time given the vast population. But I think the people are being motivated to go and get the vaccine as well.
That's good to hear. And Tim, would you have any insights on raising awareness of long COVID and the implications of it?
So I agree with all that's been said. I think we've put a huge amount of effort into the vaccination program and the awareness of that. And there's still pockets where there's more to be done. But I think we have got that profile up, and I think long COVID will continue. I think to make more and more news, particularly I think as the third or fourth wave start to move away a little bit, because I think it's a much longer, obviously a much longer time scale. But I think for me it's about keeping it in the news. It's about publishing data. It's making the data the facts. There's a lot of myths around. So I think there's a lot of work to be done, just as there is with vaccines, to myth bust. Actually, a lot of people are still thinking it's not as real as it is, and that's why I think we do need to be publishing firm facts and figures regularly around the numbers of people, the implications, and some of those case studies, those patient stories are very powerful as well, I think, to get messages home. So I think there's a lot to be done, but I think there's a lot being done, so I think we're not in a bad place.
Good. That's good to hear a bit of positivity as well in the light of that. My next question would be for you, Tim, actually. I was interested, in the point you were making earlier about the importance of social care, which I definitely agree with. And we're obviously allied health professionals here today, and a lot of variety in the crowd. How, with NHS at Home, how are you sort of looking at that interface between health and social care and working to improve that? Because I know obviously home care probably leans very heavily on social care staff.
It does, and I think as we look at people as individuals and provide personalised care in the round, and really talk to them about what matters to them and understand what their goals, what's important. It isn't just limited to healthcare; it's a much broader conversation, and social care comes in, but it's also the wider determinants. It's, do they have a job? Do they have somewhere safe to live? Do they live in a reasonable place? Do they have access to green spaces? There's lots of factors that I think are really important to keeping people well and for their health and well-being. And so I think that interface, that integration is really important. And as we move in the NHS, as sort of another change towards integrated care systems, which are being set up at the moment, I think that's a really important opportunity for us to work at a place level across, health and social care, because it's a team effort that's required to support these people, and it isn't just about the NHS. It is a wider thing. And I think with initiatives like social prescribing, which is one of the components of personalised care, and linking people up with their local community for, those wider potential support offers, I think that's got a huge amount of role to play, not just for health, but for social care as well.
Brilliant, thank you. And I guess on that same topic, my question for you, Tejas, would be, what's the status of social care in India like at the moment, and is there any interaction of social care with care of long COVID patients?
Right. So we have a governmental setup here in the institute where I'm working. But as I told you previously, a large proportion of the Indian healthcare system is actually healthcare is delivered by the private sector. So that is not as organized as the NHS is, which is more of a socialized system. So that way, I think there are gaps. But the governmental setups, especially the medical colleges, they are developing their own systems, their own clinics, post-COVID clinics at various places. So the district levels as medical colleges, and they are providing the care for the patients who have been discharged from their own hospitals.
Excellent. And obviously you've been working in hospital environment kind of throughout these waves of COVID. How's the situation been for you, and is there much concern amongst health workers in general about long COVID?
So yes, so things have evolved a lot in the last 1 year. So the first year there was a lot of fear among healthcare workers about COVID, and we understood very less about it. But now that most of the healthcare workers have been vaccinated, and in COVID for almost 1 year, more than 1 year now, and many have been exposed, many have suffered from it. So now there is not so much of fear, rather there is there is more of understanding of what kind of precautions really work and what don't work. So because of that, the fear is not there now, and we have developed workflows where we can minimize our exposure. And in particular with long COVID, yes, many healthcare workers have had problems in work, like because we as healthcare workers don't have the luxury to take long gaps. We have to join back at work after we recover from COVID, and many times we do have to join back before we are fully fit, so to say. So we are still having fatigue or dyspnea, or we are having some poor concentration. But I guess that is the main concern for healthcare workers.
Thank you for that. And I think, we have similar problems in the UK, definitely, with people sort of feeling that pressure to come back to work and to contribute, as the pandemic rages on, really, in the UK. We're nearing the end of our time now, so I'll begin wrapping up, and thank you both for such an interesting discussion. I think the last question I'm going to ask is not long COVID related, actually, but it's we've got a lot of healthcare students here today who are maybe about to start their careers. I myself, have just graduated, so I'll be starting work in about 2 weeks' time. So I guess, what would your advice be for a healthcare professional starting out their career? Any sort of kernels of wisdom you could share? And I'll go to Tim first.
Well, it's a great question, and for me, I think it's following your passion, follow what you're interested in, because you tend to be happy when you do something that you love doing, you're good at, and actually someone wants or needs, and there's always going to be a need for healthcare. So the third part is definitely tick. So I think I'd follow what you really love doing, and tend to be good at what you love doing. And I think my second bit, if I'm allowed a second, would be to try and make yourself a little bit different, a little bit unique to other people. So try and create some skills or some learning or some expertise around something that nobody else has got. Because I think, whilst there's 350 different roles in the NHS at the moment, I'm sure there'll be another 100 new roles created over the next 10, 20 years. So, just create opportunities for yourself by being a little bit different.
Thank you. And Tejas, same question to you. Any wisdom to share for our healthcare professionals of tomorrow?
Yeah, I think what Dr. Tim said is very important, and I think I can't give any further pearls of wisdom, but what I have realized from my own experiences that don't be too hard on yourself, don't beat yourself up, and because whatever work you are doing, it's important, and everyone makes mistakes, but then you have to go on for the people who you have to treat further. So you should not. You should keep yourself motivated and take care of yourself as well. Because if you take care of yourself, and if you don't beat yourself up, you will be able to do better work for the people who are looking out for you.
Definitely. Thank you very much to you both. I know half an hour definitely isn't enough time to talk about long COVID fully. I mean, we could have a days-long seminar on it, I'm sure, but I think some really interesting points have arisen today, about addressing inequality, helping people get well at home, the importance of social care in the situation. So I think people watching today will have taken some valuable learning from that. So thank you again. And with that, I will pass back to the Health Careers Live team in the studio and see if they have any more comments for us.
Wow, can you guys hear me back here?
Yep.
Fantastic. No, thank you so much for taking the time to kind of tell us all of your thoughts on long COVID, the challenges, solutions, and advice for the doctors and healthcare professionals of tomorrow. Just wanted to get your opinion on kind of ICGRx for starters. I've got two questions. Firstly, kind of, why do you think the work of ICGRx is so important?
Well, I think it's arisen today in the panel discussion. I mean, Tejas, you yourself were saying, it's important to have that education, and that education is reaching everyone rather than the people who maybe have the means to access it. So that's what we try to do with ICGRx. We do these free open access events to allow people to access that information. So I think, that discussion has highlighted that. And with the advent of telemedicine, more and more people are going to be accessing their information online.
Tejas and Tim, would you guys agree?
Yeah, absolutely. I mean, one of the things we've really learned in response to the pandemic is around sharing learning and building really strong learning collaboratives, and loads of really good ideas and fantastic practice going on everywhere, all over the world, all over the parts of the UK. The real trick is to surface it and share it and build on that. And, I think this is a really important forum for sharing ideas and learning and knowledge. And I think, that's super important. And I think, we've really demonstrated the power of that during the pandemic.
In fact, ICGRx is now several years old, but I would say that the pandemic has emphasized how important it is, because now, because of the pandemic, we have embraced the technology to reach out where we can't go before. So I think ICGRx is only going to grow in the future.
Just to take you on that, Tejas, can you hear me?
Yes.
Oh, great. So actually, part of the idea for ICGRx was an experience. So Tejas mentored me on my medical elective at the All India Institute of Medical Sciences. And he was just a few years qualified. And I remember a grand round in the department where there was an actual patient in the room. And I feel that is so missing now from the grand rounds we have across the world, where we're just anonymized case presentations. And that really inspired me in how you've, really have patient-centered care and you have everyone in the room. So Tejas joined us for the first grand round in 2015, was it?
Yes.
It's amazing to see how we can, through technology, we can bring so many people together, and really looking forward to tuning into more sessions and seeing how we can keep that dialogue going to share knowledge globally. Something that Jed Byrne often says. Jed is the Director of Global Engagement at Health Education England, and his mantra very much is learn globally but act locally.
Well, Tejas, Tim, Maarja, thank you very much for your time. Hope you enjoy the rest of your day.